All right, let's jump right into a really critical topic in pediatric care. What to do when a child is struggling to breathe. This is something that comes up all the time, and the stakes are incredibly high, so knowing the right approach is, well, everything. Let's get into it.
And this quote really sets the stage for us. It gets right to the point. With kids, respiratory distress can turn into respiratory failure, and it can happen fast. We're talking about a situation that can go from serious to life-threatening in what feels like the blink of an eye.
So you have to ask why. Why so rapid? Well, that brings us to a super important point. You really can't think of children as just miniature adults, especially when it comes to breathing. Their bodies are just built differently, and that creates some very specific vulnerabilities. Let's break down exactly why they're so different. First off, their airways are just smaller, so even a tiny bit of swelling can create a huge blockage. Then you've got their respiratory reserves. They basically don't have much gas in the tank. Their little breathing muscles get tired out way faster than an adult's. On top of that, their bodies are running at a higher speed, so their basic need for oxygen is already cranked up. And finally, all those backup systems the body has to cope with stress, they're just not fully developed yet. It's really a perfect storm, and it explains why things can go downhill so quickly.
Okay, so because of all these vulnerabilities, we have to get really good at making a key distinction, and that's recognizing the difference between respiratory distress and respiratory failure.
So, what is the critical difference here? I mean, how can you tell them apart? Nailing this is absolutely everything, because it dictates what you're going to do next.
This table is perfect for showing the contrast. So look at the distress column. Here, the body is still fighting. You see fast breathing, a racing heart. The child is anxious, for sure, but they're with you. Now slide over to the failure column. This is where the body starts to lose that fight. The airway might not be open, breathing gets super erratic, or maybe even stops. The heart rate can actually drop, which is a really bad sign, and you might see that bluish tint to the skin. That's cyanosis. But the biggest clue? Look at disability. The child is lethargic, maybe even unresponsive. That's the cliff's edge.
So, to really boil it down, respiratory distress means the body is working overtime, it's compensating, it's a struggle, but it's working. But respiratory failure? That means the compensation isn't enough anymore. The body's systems are exhausted, they're failing, and that's when things get truly critical.
And here is a hard number you've got to keep in your head. If you see an oxygen saturation dipping below 92%, especially if the child is already getting extra oxygen, that is a massive red flag. That's a sign that you're in failure territory.
Okay, so we know how to spot how severe the problem is, but what's causing it? Generally, the root cause falls into one of four main categories.
And here they are. You've got upper airway obstruction and lower airway obstruction. Then there's lung parenchymal disease. That's a fancy term for a problem with the lung tissue itself. And finally, you have disordered control of breathing, which is a brain issue. Let's dig into what these actually mean.
This is a great way to think about it. An airway obstruction, whether it's upper or lower, is basically a plumbing problem, right? A pipe is blocked and air can't get through properly. Lung parenchymal disease, on the other hand, is more of a filter problem. The air might be getting to the lungs just fine, but the lung tissue itself, the filter, can't do its job of exchanging the gases.
And that fourth one, disordered control of breathing? Well, if the first two are plumbing and the third is the filter, this one is a command center problem. The brain just isn't sending the right signals to the lungs. This could be from a head injury, an infection, a drug overdose. Something is disrupting that fundamental command, breathe.
So we can spot the severity, and we have a good idea of the potential cause. Now for the most important part, what do we do? The response has to be targeted to the specific problem we're seeing.
But before we even get to the targeted stuff, there's one thing you do always, no matter what, and it's this: give oxygen. It's the simplest and honestly the most important first step you can take for any sick child. It buys you time. Precious, precious time.
Okay, so after you've started oxygen, then you get specific. If it's an upper airway problem, you're looking at things like steroids to bring down swelling. A lower airway issue, like an asthma, that's when you reach for inhaled meds like beta agonists to open things up. If it's a lung disease like a bacterial pneumonia, then antibiotics are the answer. And for that command center problem, you have to treat the root cause. Maybe it's anti-epileptics for a seizure, for example.
And all of this brings us to a really core principle of pediatric emergency medicine. You don't just do one thing and walk away. It's not a one-and-done deal. It's a constant, active cycle.
We call it the evaluate, identify, intervene cycle. And it is exactly what it sounds like. You evaluate the patient. You identify the biggest problem right now. You intervene. And then, what do? You go right back to the beginning and evaluate again to see if what you did worked. It's a constant loop. Assess, act, reassess, over and over.
And why is this cycle so incredibly important? Because of this. In kids, respiratory issues are one of the main reasons they go into cardiac arrest. It's a huge difference from adults. With adults, a lot of times it's a primary heart problem. But with children, the breathing fails first, and that's what causes the heart to stop.
So this whole cycle, evaluate, identify, intervene, it absolutely saves lives. But it has to start somewhere, and it all hinges on that very first step, early recognition. The whole life-saving process can't even begin until somebody spots the problem, which brings us back to the most critical question of all. Do you know the signs?